Uh, Hi, everybody. Welcome for the life coach certification program for exclusively for mental health professionals. This is creating a big revolution on today's market for a lot of doctors, psychologists, nurses, social worker, HR trainers, therapists of different professions, but they should be in a service profession. So that was the miracle. Then that is the reason we have integrated a lot of different schools of technology, the schools of learning, and we have made the subject very popular. Already we are mentoring a few doctors, and this we create an awareness on this so that you can join this and make your own profession as the number one profession, and you will have a global market. This I can promise. I can promise you that you're going to rule the world, provided you know this science. Okay, let's go into this. Dive into this. I'll, yeah, you know me. I'm Dr. Sundaram, yeah, a suicide survivor, now a mental surgeon, and relationship, couples relationship practitioner, a joint family of 40 members, a visionary wife, two dogs. Okay, ex guy with work with Bell Hospital, and now on my own, I have my own mentoring sessions throughout the globe, right? And transformed in 25,000 families. And you can go and check up my work on the 7 YouTube videos. Okay, that's my simple introduction. Let us go ahead. Um, yeah. So if you look at the origin of this course, the origin of this course is very, very worth listening to this because this is my own from my own journey of struggle for the last 30 years. Okay, what actually has happened is I'm a mental health professional. I'm a suicide server. I'm a mind surgeon. I believe in revive your mind, edit your heart, and rewrite your own story. That is my message to this world. And my mission is to help 1 million couples. Okay. My I did my MS counseling and psychotherapy, and when I started practicing about 2 decades ago, I had a lot of energy, excitement, like you, all youngsters. बोला कि भाई चलो दुनिया को अपन काबू पा लेंगे. Like in a जोश, at that time. देन हमने क्या काउंसलिंग वगैरह किया, had a 2 3 clinics running very nice. पूछ रहे क्या कर रहे हैं, अरे काउंसलिंग है, three clinics are there going very full, but money nil. And I went to a lot of doctors, a lot of medical doctors, and they had their own helplessness. There are their own limitations to help me out. And one was a very shocking incident was when I, after 3 hours of counseling, I asked the parent to give me 100 rupees. So like, no, sir, I will not give you 100 rupees. आपने बात की, so whatever I am talking in my house, you are talking it. Why I should give 100 rupees? He kept me 10 rupees in my hand. So that was the biggest shock of my life. अरे यार, PG किया, ये किया, वो किया. There's so many things. Or I'm earning 10 rupees. That's the very, very sad part for me. When I went and asked my professions, doctors, psychologists, they are still worse than me. है तेरी हमारे यहाँ कहावत है कि बाहर शेरवानी अंदर परेशानी. Okay, a very 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 good quote, but nothing in the the quote packet. So that was the thing of my but then I think I got something wrong education. Then I came under the influence of one Padmakar, Professor Padmakar from Vellore Medical College. He was a person who was creating miracles through counseling, through psychotherapy, not at the individual level, at the industry level. So I was under the influence of his mentor Padmakar, and he has changed my perspective. And I came to know his success only because of he is aping West. His gurus are from West. And these people are producing 100% measurable result. 100%, please send me 100% measurable result. And now I also tell the same thing to my clients. I am not producing the result. You are producing the result. So this is missing in this particular method of I learning. So I integrated many things. If you one is NLP, then quantum psychology, then I become a coach. I'm a digital marketer. All this thing combined together now. You can see my work. I'm the number one married couples course in India. If you go to proctor.com and you put in Chennai and in psychology, I'll be number two or number three. तो आगे पीछे होते रहेगा. वहाँ पे you can see the what do you call the testimonies of the clients who have gone through and who produce results. Okay, so now this is what I'm going to teach you: how I became successful, how I integrated different schools of learning. Okay, And that is one. Now I'm mentoring many health professionals. I'm working two doctors from not one from UK, but mostly all are Indians. Okay, across the globe. Yeah, my market is throughout the globe. This is what I'm going to share this in this course. This is how the basis of this course is not theory. It is not theory. It's from a fully from my practice. Okay, next about this course, it will give a complete old life is gone. You will have a new life, new energy, new success. There's something called one is a struggle, another is survive. From struggle, you have to come to survival. Survival to success, success to significance. Now, I'm not doing a career. I'm in a calling. मैं दुनिया को whatever I learned for the last 30 years, I am giving to society. Because in Vedic tradition, there is something whatever you have taken from the society, you have to give back to society before you leave the society. So I'm in this method, a comprehensive, in-depth understanding of life coach skills. What is a skill? Skill is an application of science. It is not knowing, it is doing. So this you will come to know life coaching skills for mental health professionals, exclusively for mental health professionals. Number one. The basic premise, basic assumption is there is a gap, knowing doing gap. We are bridging the knowing doing gap. क्या कर रहे हैं? The knowing doing gap को अपन minimize कर रहे हैं. Okay. You know that if you look at the scan the knowing doing story, there is something like knowing more and doing gap is there. Here is a professor. Her knowing skills are more. She has read a lot of books. She has a PhD, a double PhD. She can talk on any subject, right, left, east, west, north, south. But doing both come. So that means she can be a good guide, but she cannot be a good practical person. And the other side, you see the doing and being gap. What is the doing and being gap? Uh, Here you got a knowing and doing a gap. This girl represents the knowing doing gap. Okay, knowing is more, doing is less. Here, doing is more, knowing is less. For example, this girl is cooking. You see, can see this. This girl is cooking, but she can cook only for her brothers and sisters. She cannot cook for 10 people, 20 people. Okay, or 30, 40 people. Okay, she cannot become an expert. So there is a doing and being, becoming angle. So if we combine these two scans, you get a third scan. This is called becoming an expert. What is becoming an expert? You become a master chef. What is the difference between a cook and a chef? A cook is a person, he doesn't know much of the recipe. Whatever the recipe is given to it, he can execute that. Whereas master chef can prepare. He's like a doctor. Like a nutritional doctor, in charge of kitchen, in charge of stores, in charge of the whole hotel. He can design his menu according to the sports requirement, according to manage requirement, according to a dietitian requirement, according to party requirement, according to fasting requirement, according to whatever is required, he has got ready with that. So he's a master chef. He can make the menu as per the nutrition requirement. That is where you become. You have to become the master chef so that you can be able to position to design the menu. You design your own menu for your client of any person in the society. So that is what we're going to make you here. So that is where the knowing and doing gap is closed conceptually, right? You know the simple. See, you read there is a book. A person is know what happens when you go poor knowing is equal to poor doing. Poor recipe is equal to rejected dish. What has happened? This person has gone and went to read a book. 30 days swimming champion, become a champion in 30 days. How to swim like a professional in 30 days. Okay, he has read the book right and left 3 times, 4 times, 5 times, 10 times, and 11 times he jumped. He jumped vertically and came horizontally. क्या हो गया? Rejected dish. So this is what's happening because of this poor theoretical knowledge. People think theory is equal to knowing is equal to doing, and that is where they get frustrated. Clear? Okay. So what we're doing is we're giving you a recipe. Make your own recipe. Okay. This is how the approach is a little like a truth of the healthcare industry. We're all healthcare professionals. This will be the presentation. How healthy is the service? See, what is mental? They are giving a service, isn't it? I'm having a service. I'm having a pen. I'm giving this pen to you. You are the receiver. There are two persons. One is a giver, and another is a receiver. Isn't it? So mental health practitioners or health practitioners are giving a service and they are taking the service. That means there are two drivers. Driver one is the giver, driver two is the receiver. So let us also look at certain facts and let us shocks and challenges and how they shock the present shock, how we are going to come out, and you will be a part of the solution of coming out of this and helping and rescuing the mental health profession of the world. You're not doing it for your sake, you're doing it for the sake of helping the mental health profession of this globe. Okay, let us see one second, one by one. I told you how healthy is the service. A group of medical and non-medical staff, okay, they give a service to the client. They give a service, and there's a service taker. And as a result, what happens? They increase, they get money, revenue, and the revenue goes up. In this thing, there are two things. One is the service given by the staff. This is the service given by the staff, and this is the service received by the staff. Are you getting a point? Service given by the staff. So that means there are two persons. One is the service giver, another is the service taker. So, how is he happy with the service? This is measured. The person was received. It's called a patient satisfaction survey. You might have heard about it. If you are in the medical corporates live, you will be knowing about the patient satisfaction survey. These are the two drivers of the any hospital revenue. So, if we take the Gallup survey, the worldwide survey, as far as the patient satisfaction index is concerned, from 2000 to 2020. See, first is from 15 to 20. That is where the margin of service, nobody is giving a score above 15. That means 15 to 20 means what happened? 5%, your 5 units are improved. Even in a developed nation like America, where a lot of technological breakthroughs are happening, technological services are available, they are not able to improve the service. Only 5%. And one more truth they have to look at is that as a result, the employees, the service giver, are unhappy because this is related to their performance, and they have also had the loss. The revenue is going down. They are having a loss. One more truth is there is a shortage of medical professionals. This is also equal to the medical professionals includes also mental health professionals. The gap is growing. Gap is growing because the supply is less than the demand. Okay, requires 859 lakh, and what is the worth is 700. Around 200 shortages there. Okay, these are the three things you have to keep in mind while working out of it. Okay, and the biggest challenge is the COVID challenge 19. COVID 19 is even the biggest challenge, which to tell you frankly, we were not prepared for it. Medical world was not prepared for it, and there are medical people lost their lives, and these are all hidden secrets. You will be knowing it from your own community, and we are not ready for that. The greatest people want one is the medical, the people who are connected and the police personnel. They have lost their lives in this game. And what has happened is sanitation policy, sanitation rules have become 80% of the cost, 30% of the cost, 20% of the cost has gone for the sanitation. This is an additional burden on the patient's head. And there is an emergence of another what is the work from home career. If you look at the COVID period, to come out of COVID, two things has happened. What is it? The sanitation process has been increased. That has increased the cost of the service for the patient. And all the patient has been, all human being has been gone to go and work from home. The people who were available in industry, now they are not available in industry, not available factory, not available office, they are working from home. And these people who are working from home, they are not going to hospital, they have find their own solutions. Okay, they have find their own solutions sitting. They don't want to go because they for them the assumption is that when I go to hospital, there are cases where people have become more victim by going to hospital rather than not going to hospital. So five disruptions happen as a result. What has happened? One is the Amazon effect. What is the Amazon effect? Any book, any theory, any story, books are being supplied to your doorstep. And the digital revolution, the clients who go, they do their homework on Google, they do the homework on Wikipedia, they go through the articles and they come out. Okay. And a lot of regulatory methods are there. There is a problem of the insurance problem is there. There is sometimes the people may get the money bill back, or sometimes they may get the reimbursement. Sometimes the bill problem is there. Then nowadays, all things, all in between, all the supply chain from doctor to patient, they all started making the consumerism. And they started the people had their own medicine, maybe the grandmother medicine or a home medicine or Ayurveda, and they found out their own personal medicine. And now the story is 80 was the patient preferred telemedicine. That means the medicine over telephone, okay, or telephone or online medicine. That is the status. The biggest shock is this one. 80 was people want telephone medicine. Say even before I had three clinics in Chennai before COVID. They're around 30 kilometers apart. Daily has to go up and down there, right, left, east, west. And now what has happened is after the Zoom COVID, I'm on 100% minus Zoom clients, all NRA clients. Daily I get three. Okay. So that is how the profile of the client has changed. So these are the things which already we talked about it. They're taken from an article. I written the source there. So what has happened? Now what is happening? There is a suffocation in the health industry. The oxygen for the doctors is slowly reducing. Asthmatic attack, the bronchitis attack. Okay. So oxygen, what is oxygen for the hospital? The patient satisfied. The more the patient satisfied, more the money, more the doctors can survive, more the medical community can survive. Agree with me? So this you can see a picture here. What happened? They look at this person is suffering. He can be a doctor also. He can be an individual also. He can be a patient. He can be a doctor. So now the point is very clear. The signal is very clear on the wall that until unless you satisfy your patient, you cannot survive. You may have the biggest hospital, you may have very beautiful receptionist, you may have a very glamorous hall, enjoy everything, but all are lying vacant there. The one measure, one point is you have to give the oxygen. Patient satisfaction is oxygen, and that is the reason you can see. I always insist on my client's feedback. The more I get a feedback, the more I get client. That is the reason what has happened. 100% become online for me. Because you go to Proctor.com in Chennai, psychologist, you put my name there, you can see 100 and 110 clients. And already I'm there social media for the last 20 years. You can see my profile anywhere. Number two. So very clear now the patient or having an doctors are having an asthmatic attack. Then how to come out of the asthmatic attack? So this is a triangle game. What happened? One is the sorry, patient satisfaction. One patient wants satisfaction, but he will be at home. Are you getting the point? I'm ready to give the satisfaction score. दे दूंगा आपको मैं 10/10 मार्क दे दूंगा कोई बात नहीं है मगर मैं घर पे रहूंगा I will not come to hospital because when I get outbreak I get more infected. Okay. So बोले डॉक्टर साहब बोले don't worry I got telemedicine. Okay, I will connect to you. You be at home, I will be at home. I will connect. That's what I'm doing. So in this triangle game of patient satisfaction, work from home, telemedicine, you can put it in three forms. Patient satisfaction is one. When the patient satisfaction is poor, clients will not come. The circle will become two. And telemedicine is absent, you can never join. So once you connect all these things, you get an equal area where that is called life coaching is a solution. Okay, it is not life coaching, it's not doing, not knowing. I become an expert, you come to me, nobody will come. They should feel you are an expert. That comes about how you can demonstrate you are doing in one session. You should be able to convince your patients or your clients or your consumers, whoever it is. This is life coaching is the triangle way of seeing आपको that all three this is called a Venn diagram where these three all circles are saying there is what life coaching the skills which you are going to learn in our program, the skills where my clients are learning this program, they are saving them, they are improving this service, and now we have become a part of the already 40% of the United States, USA has joined this economy. So what is it we are giving? We are giving an oxygen mask kit for all mental health professional. Please understand. Don't think that we are giving a skill. It is a mask which you learn, use it, you give a mask for others. You have your own mask, give it mask to others. So description of the code. Let us go into the code. The coaching is a doing skill and not a knowing skill. Not a book पढ़ लिया, you become expert. PG, post graduation nahi. And this matures over time. We give you a skill, you have to make it of this. It is like a mother teaches a baby walking skill. The baby has to slowly learn. Daddy teaches the bicycle skills or car driving skills. The has to be done. This is only initiation of the skill. And a psychology-based coaching approach in a process which can be practiced right in a clinical setting. You can next day itself you can practice it. Okay. The main focus is transformation through results, not information. This is not information, it's only transformation. And this we are decade from taught by 2 decades of expertise with my 10,000 hours of coaching at hospitals and clinical settings. This comes with a price. The price is my 20 years experience. So you may ask me why LCC now? Because consultancy and counseling is a time regulating model with partial impact. If you look at consultancy, a doctor comes, you ask him, okay, consult goes over. You forget because whoever gives a better consultancy will go. So your clients are gone. What is the counseling? What do you do counseling? And afterward he says, okay, sir, I'll come there. Okay, sir, okay. So it's like listening to a stereo and advisory model. So how many advices you have taken, how many advice you have implemented, or how many advice I have implemented from my seniors. So this is a weak model, partial impact. हाँ, very good to listen, but very difficult to practice. आफ्टर यही बोलेगा अरे नहीं भाई डॉक्टर साहब ने अच्छा बात बताया था मगर अपनी लाइफ में नहीं हो गया यार अपनी जॉब है अपनी ट्रेवल है नहीं so that is the model which the counseling and there is a lacuna in the consultancy and counseling model. Whereas coaching is a clock building model. What is clock building? From second, it's becoming minutes, minutes are becoming hours, hours are becoming days are becoming weeks, weeks are becoming life. So that is how the clock building model. Focus on results and accountability. What is results and accountability? You make a recipe so that he makes his own homework, comes back, tells his own results. You don't tell the result. He comes and tells his own result. You are not giving the result. No, no, this is called a gig economy emerging. Gig economy is eroding the traditional employment. Traditional employment has gone. Already I told you 50% of the US economy has moved to this. And 10 to 20% has in India has moved to in Asia has moved to this. This helps you to carve a niche as a pioneer in the global market. We will also teach you how to make your own impact on this world economy, how to become your own specialist, how to project yourself, how to make a different in your service and make money. So what you will learn coaching skill is a doing skill, how to establish goals, how to recreate plans and measure results. We also talk about NLP because NLP coaching is already measurable. Please understand, coaching is a measurable skill. Coaching is a doing skill, not a knowing skill. That is the biggest element here. Okay, this comes from practitioners, not from theory to practice, from practice to theory. Then another domain is NLP mind programming. NLP is one of the breakthrough or psychology in the measurable 100% result oriented. I always tell my clients अगर result नहीं आ रही तो दो mistakes are there. One is you are doing a mistake or I am not teaching you. You are not listening or I am not teaching you. So this skill is used for how to improve yourself, how to improve your team. And the third is yes, we are in a digital world, knowledge world. Okay, where you have to how to project your practice, how to project yourself as specialist. Okay, irrespective of your career, because you have to identify your own niche and how to make your presence global. This is what you'll be learning about. And of course, there is also online support for certified cases who go through our institute. And this will be the biggest measurement, and you will become the unique person, and you are a person who is contributing society. You are not a parasite. You are become a contributor to society. So who can do this? All people, all mental health professionals, or maybe a psychologist, psychiatrist, counselor, therapist, nurse, family nurses, pastoral counselor, clinicians, and any mental health staff. And what do you get is 3 months online training. And earlier we were doing offline, but now because of COVID, we changed the model. Now 2 months supervision, you'll be getting a supervision for people who are a little more serious, and 30 days hand-on support. Okay. Then you have got a mental health practitioner, mental health personal coaching certification, and will also be in our community so that you can learn from each other. Okay, this is where we wanted you to join this movement. It's a big movement. Now, very few people are there, and we are producing results, and we want you to encash this. There are many a times you go by the glitter and glamour. You go to the campus, you go to big colleges. That fellow will charge 500 rupees for a prospectus. You will silently give. You will never even question. The Xerox costs 50 rupees. Why you are asking 500 rupees? Because that big glamour, big buildings and big campus. You are only mesmerized by that. Already you're on a scam. Okay, already by doing borrowing money for your education and doing an education which is not giving you a job as a already on a scam. And many people are going further for doing PhD, one more scam they are ready. But only those few persons succeed who know the truth, who invest on the truth, not on the scam. Always believe in the law of 80-20. What is 80-20? 80-20 is very simple. The majority of the people impact the minority, minority people of the impact the majority. Who are the kings, who are the queen? They are minority ruling the whole world because their thinking is different. Okay, I want you to join the minority, make a difference to you, make a difference to the society. Okay, you're welcome to comment on this below. You can contact me, or you can know more about it from me. You can fill up the form below. You can join our group, and any inquiries you can contact us. And thank you very much for listening patiently to my service. You have any questions? Welcome. You can ask questions below, and you make a difference to your own life and make a difference. Okay. I always believe in one thing. Mahatma Gandhi said that read as if you're going to live for 100 years. Read as if you're going to live for 100 years. Okay. And work as if you're going to die tomorrow. But kal marna hai, bhai, jitna bhi kaam ho aaj karna hai. So, wanted to take an action and be a part of that big million team. Right? Thank you. Thanks a lot.